Yep, it's a little
Hello. We started going live today on Facebook and introduced Dr. Terri. If you've been living under a rock, you haven't heard yet that she joined us at Long Chiropractic Center, and we're super excited. It's been about a week and a half now, and we've really enjoyed your time here, and we've seen a lot of cool things. But we just want to educate a little bit about what she does, where she's from, so you can get to know her and be comfortable when you come in to see her. So let's start by, why don't you tell us a little bit about yourself?
So my name's Terri, Dr. Graham, and I live about 20 minutes away, so I'm from the area originally, and I've worked in the Wittenberg area for the past 6 years before this, so familiar with the people, familiar with the area. I got my degree at Concordia University down in Mequon, so I was there for 7 years before being back up here. And yeah, just started here at Long Chiropractic a week and a half ago, and it's been good so far.
Awesome. All right, so we got a couple questions that people have been asking, and we'll hope to clear some of those up today. The biggest one, the first one that we got was, what kind of patient base do you see? Like, what kind of patients do you see?
Oh man, I see a lot of variety, but basically anybody with pain usually will come see me. So neck pain, back pain, any joint throughout the body pain, headaches. That's usually my number one thing, is anybody with pain in any location. But I do see people with dizziness also, so we have some ways to treat that. And I'll see people after surgery, like a knee replacement or an ACL tear or different shoulder surgeries, so I see that patient population too.
What would you say is your favorite, if you had to pick one?
I like young athletes because I don't get to see them as much. Like ACL repairs, as sad as they are for the athletes, are probably my favorite to see, just because they're so infrequent for me and they're just fun, usually fun patients. So
awesome, cool. So if a patient comes in and sees you, what are some of the treatment styles that you would do with them? What are the different things that you can offer?
Usually, again, if they're coming for specific pain, we always start them off with exercise to try to see, if they have some flexibility issues or some strength issues. We start them off with some exercise to kind of balance those things out. And then we have different modalities, they're called, so we can do an ultrasound, which is like a deep heating that'll loosen up tight things and help them heal a little bit faster. We can do some different hands-on techniques to work on tight muscles or pain in muscles. The clinic here has laser too, which is really cool, which can be used for, increasing healing, decreasing pain. That's a pretty cool modality that's new for me to use here, but I'm excited about that. We also have like traction here, so kind of increases the joint spaces in the spine for people who are having some issues with nerve compression or disc problems, things like that.
Awesome. Okay, so all sorts of different things in addition to chiropractic here. How easy is it to access you? So I know a lot of people are like, do I have to go to my primary doctor and get a referral? Or do I have to get it authorized through insurance? Or what do we have to do?
For the most part, you don't need a referral. If the person has Medicare or Medicaid, they do need a referral, but they can actually still come and see me without that physical referral. And as long as their doctor signs the note after or agrees to our plan, then it's usually not an issue. So pretty easy to actually come see me. Once you get here, most of the time the first visit is taken care of with insurance, and then we request additional visits, and we kind of work through the insurance thing after that initial session usually.
Awesome. And the other cool thing, and one of the reasons that we decided to work together, was that if you don't want to go see your primary care and you think you need some physical therapy, I can actually myself do a direct referral to Dr. Terri. So this is why the teamwork is so nice, is that everything's in-house and you don't have to necessarily do that. So if you've been in and you see me, or you just want to see Dr. Terri and need a referral, I can do that for you, which is kind of cool.
Yeah, that is a really nice thing for our relationship.
Yes, peanut butter and jelly, right?
Mm-hmm.
With chiropractic, we do a lot of wellness care in the office, so we try to keep people out of pain, and I know one of the things as you do is get people out of pain. So do you have to be in pain to come see you? Do you have to have an issue, or what?
No, not necessarily. Some people will just come in for kind of just a general check me over and see if there's anything I need work on, or they might just have a specific goal, like, hey, I want to be able to walk 3 miles and I can't do that right now, and we can help them reach any specific physical goal that they have. But yeah, they don't necessarily have to be in pain. We can, again, check them over, see if there's something that we need to help to get them feeling well all the time. And like you said, if there's just maintenance, like they need a little kick in the pants to stay on track, we can help them with that too.
I like that. I'm gonna start using that. Awesome. Do you have anything else that you want to add?
I don't know. I think that we have a really cool, unique environment here, having the chiropractor and the physical therapy together, because although we have some similarities in our profession, there's plenty of differences, and we definitely mesh well as professions together, knowing what our own weaknesses are and using the other person to fill in those gaps.
Awesome. That's perfectly said. I think that's one of the reasons I really was looking at adding a physical therapist in the office was I do a lot on joint mobility and posture and things like that, but there's more to mobility in your body. We need to have purposeful movement, and purposeful movement to me means strengthening properly and proper movement as far as your muscles go, and that's a lot of what Dr. Terri does in the office. But also it's just really nice to have another doc to bounce ideas off, so you get better care when you have two heads working together and looking at problems just a little bit differently from different backgrounds and different perspectives.
For sure.
Yeah,